Does eating carrots really improve your eyesight? We've all heard that one, but where did it come from? And is there any truth to it? Do you really need 8 glasses of water a day to stay healthy? Is it the magic number, or is hydration a little more flexible than we've been led to believe? Does cutting your hair make it grow back thicker? This one's a classic. But what's the truth behind this hair myth? Hello viewers, welcome to my channel. Today we're diving into some of the most common health myths that we've all heard at some point. We'll separate fact from fiction and give you the real story, backed by science. One. Eating carrots significantly improves your vision. Carrots are rich in vitamin, which is essential for maintaining eye health, but they don't improve your eyesight beyond normal levels. The myth originated during World War II when the British government promoted carrots to explain their pilot success in night missions, masking the use of radar technology. 2. Cracking your knuckles causes arthritis. Cracking knuckles produces a popping sound due to the release of gas bubbles in the synovial fluid around the joints. There's no scientific evidence linking knuckle cracking to arthritis, although chronic cracking may lead to hand swelling or weakened grip over time. 3. Going outside with wet hair makes you sick. Colds and the flu are caused by viruses, not cold air or wet hair. However, being cold can temporarily lower your immune defense, making it easier for viruses to invade. But the cold itself doesn't directly cause illness. 4. You should always finish a course of antibiotics, even if you feel better. This advice was based on preventing bacterial resistance. However, research now suggests that taking antibiotics longer than necessary may also contribute to resistance. You should always follow your doctor's guidance and finish the course if instructed, but more personalized advice is becoming common. 5. Sugar causes hyperactivity in children. Numerous studies have shown no direct link between sugar consumption and hyperactivity in children. The excitement often seen at events where sugary treats are served may contribute to the misconception. The idea that sugar causes a rush followed by a crash is largely psychological. 6. You lose most of your body heat through your head. Heat is lost from any exposed body part, not just the head. The myth likely persists because people tend to bundle up their bodies but leave their heads uncovered in cold weather. In reality, heat loss is proportional to the amount of exposed skin, and you lose heat from any uncovered part of your body. 7. Sitting too close to the TV damages your eyesight. Sitting too close to the TV might cause temporary eye strain, but it doesn't cause permanent damage to your eyesight. Modern televisions emit very little radiation compared to older models, and eye strain from sitting close is temporary. 8. Waking a sleepwalker is dangerous. Waking a sleepwalker may confuse or startle them, but it doesn't pose any physical harm. It is safer to gently guide them back to bed to avoid injury. The myth likely arose because sleepwalkers can be disoriented when woken up. 9. Swallowed gum stays in your stomach for 7 years. Gum is not digestible, but it doesn't stay in your stomach for 7 years. It moves through the digestive system and is excreted like other foods. The myth may have originated from the fact that gum contains non-digestible components like rubber or resins, but it's expelled like other indigestible materials. 10. Shaving makes hair grow back thicker and darker. Shaving only affects the hair shaft. It cuts hair at the surface of the skin, which can make it appear coarser because of the blunt tip, but it doesn't affect the actual thickness, color, or growth rate of hair. 11. Reading in dim light ruins your eyesight. Reading in low light may cause eye strain and discomfort, but it won't lead to permanent damage to your eyesight. The eyes work harder in dim lighting, which can make them feel tired, but once rested, they return to normal function. 12. Crossing your legs causes varicose veins. Varicose veins are primarily caused by genetics, pregnancy, and prolonged standing, not by crossing your legs. While crossing your legs may temporarily restrict blood flow, it doesn't cause the vein walls to weaken, which is what leads to varicose veins. 13. Antibiotics work for viral infections like the common cold. Antibiotics target bacterial infections and are ineffective against viruses. Taking antibiotics for viral infections not only doesn't help, but also contributes to antibiotic resistance, making bacteria harder to treat over time. 14. Eating before swimming increases the risk of cramps and drowning. While swimming immediately after eating might cause mild discomfort or cramping, there's no evidence to suggest it significantly increases the risk of drowning. The digestive process does divert blood to the stomach, but this isn't enough to incapacitate a person while swimming. 15. Hair and nails continue to grow after death. After death, the skin dehydrates and retracts, making hair and nails appear longer, but they don't actually grow. This myth likely arose from the appearance of post-mortem bodies as the skin tightens and shrinks. 16. You should wait an hour after eating before swimming. Swimming right after eating is not dangerous, though it may cause minor discomfort due to digestion. There's no scientific reason to wait exactly 1 hour, though it's best to swim when you feel comfortable and not overly full. 17. Morning sickness only happens in the morning. Despite its name, morning sickness can occur at any time of the day. It is caused by hormonal changes during pregnancy and can result in nausea or vomiting at any hour. 18. Eating chocolate causes acne. There's no conclusive evidence that chocolate causes acne. Acne is more influenced by factors such as hormones, genetics, and skincare habits. In some people, diet can play a role, but it's not chocolate specifically that triggers breakouts. 19. Muscle cramps are always caused by dehydration. While dehydration can contribute to muscle cramps, other factors such as electrolyte imbalances, overexertion, and poor circulation can also cause cramping. Stretching and proper hydration can help prevent cramps, but they're not always linked directly to fluid loss. 20. You need to drink 8 glasses of water a day. The 8 glasses a day rule is a general guideline, but individual water needs vary based on factors like activity level, climate, and body size. It's more important to drink when you're thirsty and to check for signs of dehydration, such as dark-colored urine. Your body's water needs will fluctuate, so there's no strict universal number.